Welcome back. It's time for our Africa 54 Health Report. Joining us now with news of a deadly virus outbreak is health correspondent Linord Moudou. Hello, Linord.
Hello, Vincent. Hello, everyone. Health officials in Guinea are working to contain an outbreak of Ebola that has killed at least 60 people and sickened dozens more. The outbreak has been centered in rural parts of southeastern Guinea. Meanwhile, the Ministry of Health in neighboring Liberia has reported 5 suspected Ebola-related deaths. Sierra Leone has also uncovered 2 deaths suspected to be linked to the virus. The disease incubates for up to 3 weeks, and symptoms include raging fever, diarrhea, and hemorrhages. Congolese professor Jean-Jacques Muyembe worked on the initial Ebola outbreak in the Congo in 1976.
We were thinking at the time that the disease was confined solely on the equatorial forest areas. But what happened in Kikwit, which is a savanna, proved to us that the virus also travels through regions like savannas. At the moment, we're inclined to believe it's the bats, the big bats, who eat fruit. We think they are the main virus carriers, but we still have to confirm this.
And joining us via Skype from Galveston, Texas, for more on the subject is Dr. Thomas Geisbert, professor of microbiology and immunology at the University of Texas Medical Branch. Professor Geisbert, welcome to the program.
Hi.
Hello. First of all, tell us, what triggers an Ebola outbreak?
I really don't think anyone knows at this time. As you just heard from the previous guest, bats are thought to be a reservoir host. There are potentially other hosts as well. So it's really just close contact with whatever the host is in nature. Bushmeat is thought to be a source of the virus. And then, the virus spreads upon close contact. So it's body fluids, blood, things like that.
Okay.
It's not airborne.
So the host can change, can vary. Initially, I remember earlier when we spoke about Ebola before, we heard about the monkeys. Now Dr. Muyembe mentioned the bats. So are there a difference here? Do things change over the years?
Yeah, I mean, I think bats are thought to potentially carry the virus without becoming clinically ill, where a monkey is just like a person. If the monkey comes into contact with Ebola, the monkey dies. And so I think the thought process right now is that it's probably, the bats carry the virus, monkeys come in contact with the bats, pick up the virus, and then it's either consumption of perhaps monkey meat or close contact with bats, or I think there has been some reports of bats being used as food supplement or food source.
Okay.
So and any close contact could cause the outbreak.
So there's no cure, no vaccine either. How do you contain an outbreak like that? What do you do?
That's really not my area of expertise, but usually the humanitarian organizations like MSF, the World Health Organization, of course, usually will come into the area. Rapid diagnosis is very important. And what they usually try to do is quarantine the area. The virus then pretty much burns out, and you really just want to contain it to keep it from getting into other areas or from spreading.
So quickly, the best way to prevent it will be to avoid contact with someone who is infected?
That's correct, and just good hygiene and good health precautions for first responders and healthcare workers, because it can certainly spread within that population as well. There are no vaccines or treatments for humans at the moment. There has been a lot of progress with laboratory animals in developing vaccines and treatments, and we really hope that within the next few years some of these breakthroughs will make their way to Central Africa.
Okay, great, Professor Geisbert. Thank you so much for joining us today.
Thank you. Have a great day.